You're listening to the station that serves your community. AM 1240 WGBB.com and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. I'm your host, Dr. David Scharf. Thanks for tuning in tonight. We have a great show tonight after our summer hiatus. Dr. Jenny Abraham, an orthodontist, the orthodontist on the South Shore. Jenny, welcome to the show. Thanks for coming on tonight. We had a lot of shows on cosmetic dentistry last season, and there was a lot of people, especially a lot of adults, who wanted to know about orthodontics and making people's teeth look better. It's all sort of tied in with braces and that sort of thing. So I did a little research and I knew of you, and I said, well, who's the best person to have on the show? And your name kept coming up, so thanks for being on. Tell our listeners first for a minute where you grew up, where you went to dental school, and that sort of thing, where you got your orthodontic training.
So I grew up in Utica, which is a town in upstate New York, about a half an hour near Syracuse. And I went to college in Albany, SUNY Albany, and came down to Long Island for dental school. And I remained there for my orthodontic training, and I've been here ever since. My
favorite question I always like to ask guests is, how old were you when you decided you wanted to be a dentist?
That's a good question. I think I always knew I was going to do something in the medical field or dental field. And then when I was in college, I began thinking about doing something in the dental field. And I loved my dentist growing up, so I decided this would be the way to go. And I loved working with children and adults, so I figured this was a great way to do it.
What'd you like best about ortho?
I love straightening teeth, and I love how after 18 months or 2 years, we can completely change somebody's perception about themselves and how they feel about themselves and how they look to the outside world, and it's a great feeling. So,
specifically tonight, I want to talk about adults and adult orthodontics. So, is that common now? I mean, is it I know when I was growing up, and I'm a little older than you, there were no adults that were getting braces. How common is it now that adults get their teeth straightened?
I really think it's becoming increasingly more common. Even in my 15 years that I've been in practice, I have more adult patients now than ever. Probably about a third of my patients is adults now, and it's growing.
And why do you think that is? I mean, why do you think so many adults are taking care of their teeth now like that?
I think people are living longer. I think people are taking better care of themselves. I think people are thinking how they look physically. I think that people are realizing that they can take some of that money that maybe they're using for other things and put it towards straightening their teeth, which they're going to have a lifetime now. Mm-hmm. People are keeping their teeth longer. We're not hearing about adults losing their teeth and dentures and things now. We're really talking about maintaining their teeth. Mm-hmm. And I think even now with things like implants, straightening the teeth becomes something that we do beforehand.
It was almost like 20 years ago, I think people, or even when you were in your training, I would think adults who would probably think about it and never do it. And now, you just see adults all the time that have braces on one way or another, and you can't turn on the TV without seeing a commercial for Invisalign. So it's commonplace, I would think.
It is. It's true. And I think now, after adults have their children's teeth straightened and they realize that there are some more cosmetic options for them, I think that they're deciding to do it. Things like Invisalign. Invisalign has changed the way we practice.
So let's talk about that, because I think a lot of people see that on TV. They see Invisalign advertised. So maybe talk about the traditional way that braces were done or are done, and how that compares to Invisalign, really what Invisalign is.
Okay, so Invisalign is a series of clear aligners that patients wear on their teeth pretty much full time, except when they're eating and brushing their teeth. I don't want to imply that we never use traditional braces anymore, because we still do, and there are some cases where we really need to do that. But I'm finding more and more, and how they've changed Invisalign, we can do so much more than we could even just a few years ago.
So an Invisalign is almost like a retainer that goes in that nobody sees.
It looks like a retainer. It's clear. It's easy to wear. It doesn't change the way you speak. It's really, no one knows that you're wearing it unless you tell them you're wearing it.
And is there a disadvantage of Invisalign, or are there times where it's better to do traditional braces as opposed to Invisalign?
In extremely complicated cases, I do still use traditional braces in cases that require jaw surgery or things like that. But for the most part, in most adults, Invisalign is an option.
I would think for most adults, I mean, one of the biggest barriers must be kind of what it's like for them to go to work or go to school or whatever they do, and have the braces on their teeth. So I would think the Invisalign is a huge advantage to those people.
It is. And as a matter of fact, I just had a father the other day who said we were talking about his child, and then he said, I wanted to get braces, but those railroad tracks, I could never work. I'd be made fun of every single day at work. And I said to him, they're not railroad tracks anymore. And I showed him the Invisalign, and he couldn't believe it. And he made a consultation for himself. So it's really changed how people look at braces.
What would you say is the average age of your adult orthodontic patient, if you had to kind of pick a range?
I would say, on average, probably in their 50s, but range from 20-somethings getting married to a 77-year-old patient that I just finished.
So 77, we'll talk about that in a minute. But I would think someone in their 50s, because I'm just entering that age range. And I remember when I was a kid that the braces, they weren't bonded on. They were the bands that went around the teeth. So
right.
Maybe what people have in their mind is even very different than reality nowadays.
Right. It's true. And a lot of the vision that people have, parents that say things like, when I was a kid, if you had braces, you didn't smile. You were embarrassed. But it's very different now. Braces have become a rite of passage for teenagers and really a fashion statement. And for adults, although they don't want to be seen and they don't want anyone to know they have braces, now with things like ceramic braces or Invisalign, we can provide that for them.
I know my kids like to trick out their braces. They put on different color rubber bands and stuff. Do adults do that, or they tend to keep it a little more low-key?
No, I have some adults who do that. I have maybe 3 or 4 teachers I can think of that did that for their students. They would pick a different color. One teacher would allow her class to pick the color of her braces for that visit.
And what's the typical adult patient that comes into your practice? Where do they come from? What's their, how do they end up in your office?
I think for the most part, of course, there are those patients where we're treating the children and then the parents decide to sit in the chair next to them and get started. And there are, I guess, for the most part, friends and family. We've taken the braces off. They realize how easy Invisalign treatment is, and then they decide to go ahead. So I would say patient-to-patient referrals. And, of course, dentists always send us patients, too.
Mm-hmm. What do you think... let's talk about that patient. You said she was 71 or 76?
77, yeah.
So tell me that story. 77, she had plenty of years to get the braces done.
Right.
How did she come to your office, and why did she finally decide to do her braces?
She had finally decided her grandchildren had all been treated. And she decided that she wanted to do something for herself. And she had recently lost a lot of weight. She was really taking care of herself, and she said, this is something I always wanted. I hated looking in the mirror. And she decided to do this, and we went with regular braces on her. She wanted to experience regular braces, and that's what we did. And she looked amazing.
Really? How long did her case take to finish?
We finished her in about 18 months.
Wow, so very short.
Mm-hmm.
And then what did she say when you were all done?
She actually sends us patients all the time, so she was really happy. But yeah, she was thrilled. She couldn't believe how quick it was and how easy it was, and that she'd waited this long.
Did you notice any changes in her? Did her personality change, or was she outgoing from the get-go?
As a general rule, after we finish adult patients and their teeth look beautiful, everything changes about them. Their hair, their makeup, how they stand, their self-confidence, all of that improves.
So, for people listening at home that maybe don't like their teeth or been thinking about it, what do you think are some of the biggest barriers that people perceive to having orthodontics as an adult or straightening their teeth?
I would say probably a financial barrier. People are afraid that it's a really large investment. Fear of how long it's going to take, fear of how they're going to look. Just being scared about the whole process.
Well, let's talk about that for a second. Financially, my parents paid for my braces when I was a kid. I didn't need a lot. How does the average adult who's juggling, a bunch of different things, and there's usually not a lot of money left at the end of the month, how does the average adult fit braces into their budget?
Well, I think what people don't realize is most dental plans have some orthodontic insurance coverage, and that's a great portion of it. And there's payment plans now. Orthodontic treatment can be spread out over a year and a half or 2 years. And maybe it's the cost of your cell phone bill that month, or your cable bill, or maybe it's what you spend on dinner every month. And these are your teeth that are going to last a lifetime.
See, I think most of our listeners don't realize, 5-6 years ago, nobody had an iPhone or an Android phone, and we all had those junky little phones.
Yes.
And we all spent, $30 a month. Now everyone spends $150 a month. So, you're saying that maybe the average adult somewhere in that ballpark for that, or their cable bill, can get their teeth straightened.
Yes, and I think that there's a perception out there that Invisalign is so much more expensive than traditional braces, but our fee is the same whether you're doing regular braces or Invisalign. So it's really come down a lot in recent years.
That's great. Another thing I think adults are probably concerned about, I know I'd be concerned about, is how long are the braces going to take? Because kids seem to be in braces forever,
They
right?
do.
Forever.
They do.
But is it that way with adults? Like, what's the typical time span for adults?
No, I would say on average our adult cases are 18 months, sometimes even less. I'm finding with Invisalign that the cases are finishing much faster than they used to. And I think one of the reasons is that Invisalign the movements are pre-programmed, so we know what's going to happen, and we know from the initial visit how long it's going to take. So, and we can really give people a good estimate.
I would think, and correct me if I'm wrong, that if I was wearing regular braces, that I'd be like itching to get out of them. I can't stand it. But with the Invisalign, are people like itching to be done, or they just sort of get used to it and it's no big deal?
They get used to it, and they say it's a good diet plan too, because they don't snack as much because you have to take the Invisalign out to eat. So. Oh
yeah, that's pretty funny. Yeah. I would think also for a lot of adults who maybe are, professionals or deal with the public and maybe would need regular braces, that they'd be concerned, well, how will their clients perceive them, or how will people around them perceive them? What's been your observation of adult patients who say because the Invisalign, you said people don't see anyway, that's invisible, right. But adult patients who have the more traditional braces that are somewhat visible, what are their initial apprehensions like, and then maybe what is it like once they get into it? What do they say?
I think that initially, of course, they're afraid to, I treat a lot of lawyers and teachers, and they're afraid to go into the classroom or into the courtroom and have these braces that are generally reserved for children. But I think what they realize is that they're a lot more self-conscious than people aren't really noticing that as much. And with things like ceramic braces, which are they're clear braces that are glued onto the teeth, you can't even see them. They're much smaller than they used to be. They don't look like those railroad track braces, and it goes a lot quicker than you think it's going to.
I always tell patients that everybody is so concerned about how they look that nobody else is really looking at them.
That's true.
You think it's the biggest thing. What about speech? For someone, a lawyer or a teacher who talks for a living, do the braces affect their speech at all?
Regular braces and Invisalign doesn't cover the palate or the roof of the mouth, so really speech doesn't change.
And is there any discomfort involved? There's a lot of people that are just anxious about dental discomfort in general.
I won't say that there's no discomfort at all, but the first couple of days when the teeth are starting to move, there's a little bit of soreness, but that's it. You take what you take for a headache and get through it.
Do you ever find adults who are maybe hesitant because they're just concerned that if they get braces, it's going to open a whole Pandora's box of problems? I think, I just want my teeth straightened, but if you straighten the teeth, it may mean, X, Y, and Z. Do you run across that much?
Yes, I hear that all the time, that if I get braces and straighten my teeth, then we're going to have to worry about my bones and the gum loss and the bone loss that I have. But what I tell them is that straightening your teeth always makes all of that better, because you can clean your teeth, you can get into those areas that you couldn't get into before. You have, as a general rule, you're taking better care of your teeth, and your bite and your teeth can last much longer if they're in a more functional position.
Yeah, just to chime in my 2 cents as a periodontist, I see so many patients as adults that a significant component of their periodontal problem is a result of their teeth being malaligned or misaligned.
Yes.
And their bite, the teeth not functioning the way nature designed them to bite, the forces aren't directed along the long axis. People that have straight teeth or that get their teeth straightened, I find it such a healthier situation and so much easier to maintain. And I'll bet most of your patients don't even think about that. They just think about it's going to look better, but they don't realize that it's actually much healthier for them.
Right, and functionally better, and less even things like TMJ problems that we see are eliminated once the teeth are in a more functional position.
Yeah, people adapt to a lot, but there's nothing better than really having those teeth be straight and have the forces be the way that they should. So
yes.
For people listening that will feel guilty about doing something to make yourself look better, it's really, I think the health part is just as significant as the aesthetic part. Really, that's been my observation.
I think that We all, do things like fixing our hair and taking care of our hair and our nails, and teeth is just teeth. We want to have our teeth for a lifetime, and we should have them looking great and feeling great.
I've read all kinds of studies that teeth are the first thing that people notice on somebody before hair, before skin, before eyes.
Yes.
The teeth are the most important.
Yes.
What I'm sure a lot of our listeners are listening and thinking, well, maybe I'm going to go get braces or have orthodontics, but don't know where to start. How does someone go about choosing an orthodontist?
I think you want to find an orthodontist that has a lot of experience with adults, a lot of experience with Invisalign.
Is it different? I mean, for an orthodontist, is the training different? Does the difference in experience treating adults really make a difference?
I think it's very, very different than treating children. With children, we have kids that are growing. Most of the time, children have all their teeth. We don't have wear on the teeth like we do with adults. It's a very different procedure and process. And with adults, we want to get to the end as quickly as possible, and we want to make it as painless as possible for the adult. And most importantly, I think you want to find someone who is board certified in orthodontics.
Right. So let's talk about that. What does that? I think most listeners and most patients assume that they see a specialist. The specialist is board certified.
Yes.
So talk for a minute about first what it takes to become an orthodontist beyond dental school.
Yes. Okay. So to become an orthodontist, once you finish dental school, you go through 4 years of college, you go through 4 years of dental school, and then to become an orthodontist, you go through 3 years of specialty training. And at the end of that specialty training, you're given a certificate and you can practice orthodontics. But that doesn't make you board certified. The board certification process is a separate process.
Mm-hmm. And tell me what's involved with that.
In board certification, you take a written exam, an oral exam, and then you present several cases to a board who examines you. Mm-hmm. And at the end of that rigorous process, you become board certified.
So what does that mean to the patient? Does that mean that the board-certified orthodontist is better than the non? Does it mean they've sort of been certified? What's the practical significance?
They can be, or they don't necessarily need to be. I mean, there are plenty of orthodontists that I know that aren't board-certified that are good orthodontists, but it's another way of checking and making sure that you have someone who's been examined by someone independent, who's telling you that this person is equipped to provide the best care that they can.
They know their stuff.
Mm-hmm.
How many hours did you study for your board exam?
I couldn't even.
It's hundreds, right?
I blocked out that year and a half of my life. I don't even remember.
I have my perio boards, and I think most patients don't realize it's hundreds and hundreds of hours of study, and really reinforces what you've learned. So
yes, and there's a recertification process, which I think I'm up for in 2021.
So it's not just a stale credential. In other words, when someone sees a board-certified orthodontist, they know that on an ongoing basis, they're being sort of certified to the highest level of knowledge.
Yes, and you need to do that to keep your board certification.
I give you a lot of credit. It's few people put themselves through that torture, and it's really self-imposed torture because you don't have to do it to make a living or to have a good practice. But your patients should appreciate what you go through to do that, because it's quite a bit of work, and it's to be commended.
Thank you. Yes, it was a long process.
Do you find most people who come in for orthodontics, adults, some of them are probably married, some are single. But of the married ones, do you find that the spouse is usually supportive of their decision to have orthodontics or not as supportive? Is there a general observation?
I think there are two groups. I think there are some spouses that are really supportive, and those are usually the ones that are sitting there with their spouse. And then there's the other group where the husband or wife will say, well, I have to go home and talk to my husband. And then it's not going to be a good situation for them. But I think that and oftentimes I'll tell them to bring their husband or wife in, and I'll review it with them, because a lot of times seeing those photos on the screen and seeing the reaction of their husband and wife to those photographs can really make them realize how important this is to their husband or wife.
Do you think that many times when the spouse isn't supportive of the decision, that they have a true appreciation for how unhappy the person is with the
right?
With the teeth?
I do think that. I think many times they just don't understand how self-conscious the person is, and usually that's it for adults. It's I don't want to look in the mirror anymore, and it goes beyond just discolored teeth, and I need to whiten my teeth. It's getting them straight, and it's so common now to have patients come in that say, I always wanted braces and I could never do it, and I'm finally going to do something for myself.
I think most people would be shocked to find out how inexpensive it really is. I mean, $150, $200, $250 a month.
Yes.
Again, most people, that sort of disappears without us even knowing somehow.
Right.
A Starbucks or something like that.
That's true. Yeah.
And I would think a lot of spouses, like human nature is not to complain. So if you're unhappy about something, most people don't complain about what they're self-conscious about. They just sort of keep it inside and, bubble it up.
Yes.
That's. What do people say, when you have patients who've put it off for a long time, and they finally finish? I mean, what are the reactions like in terms of, what they say, how they look, that sort of thing?
Tears.
Yeah.
A lot of tears of joy. Just most of the time they're saying, I can't believe I waited this long. And those patients end up sending so many of their friends and family. And I have 2 sisters right now that I'm treating that they both said that they wanted this so bad, but there were 6 children in the family and they just couldn't do it. So now they're both in treatment and they sit next to each other in the chairs.
That's cute. And when they say that, they can't believe they waited so long, do you ever sort of like step back and say, well, why did you wait so long? Like, do you ever have that conversation with them?
Yes. Actually, one of them I did with one of these sisters, and she said that she had children and they were small and there was no time. And she felt like she couldn't invest the money or the time in herself, which is, a constant refrain. We will do it for our children, but we won't do it for ourselves.
Right. And then what's the trigger sort of that gets people to come in most times?
I think either hearing about it from someone else. I think Invisalign has done a great job with that because now people see that there's a cosmetic option. Maybe they won't be as embarrassed. I think realizing that it's not as expensive as they thought it would be, and not take as long as they thought it would be. And I think just really thinking that it's okay to do something for themselves.
It sounds like it's so many misconceptions that hold people back more than anything.
Yes, I think that's true with adults.
Do you think that are men any less likely to do orthodontics? Like, do men have a different set of misconceptions maybe than women do?
I think I have to say of my adult patients, I have less, definitely fewer men, but more and more requesting Invisalign too. So men are self-conscious too.
We are. We don't like to admit it, but we like to look good. That's for sure.
Right.
And do you ever see changes in people? I know before the show we were chatting and you told me a story about a teacher who was always self-conscious in front of the class and whose students used to actually, sort of taunt her in class. And I thought that was a very moving story. Maybe you could tell our listeners that.
Yes, I had an experience recently with a teacher who, I believe she was a middle school teacher, and the children would actually insult her and make fun of her teeth. Fangs, told her she had fangs, and she was really, really self-conscious. And you wouldn't think that, an adult like this who's teaching in the classroom would be so upset by this, but she was. And when she finally got her teeth straightened, she was a different person. Smiling, her hair was different. Her self-confidence, and she said teaching was different for her.
Really? It's hard to imagine what her pain was like. Every day going in front of those classes, because even though you're being ridiculed by middle schoolers, it's still being ridiculed. Who likes to be ridiculed at all?
Right, and to go home feeling that way
every day
when there's something you could do about it. Right.
I wonder if she became an easier grader afterwards, gave that more A's.
Either that or harder. I don't know. Yeah.
Probably easier. So is that common? Like new hair, new makeup, new spouse, the whole thing. People get their teeth fixed and they just move on to a better life.
That's right.
That's pretty funny. Do you ever work in conjunction with, do you ever have cases where, say, a dentist is doing cosmetic dentistry? Because I know sometimes when I spoke with cosmetic dentists and they spoke about how they did cases, that sometimes they would actually interface with the orthodontist, that you would do some part to move the teeth in a better position and then they would kind of dress the teeth up.
Yes, I think that we do that most frequently with adults, because there are sometimes adults who are missing teeth who need an implant, or adults that need their teeth whitened once we're done, or may want veneers to change the shape of their teeth when we're done. And we always do the orthodontic process first and get the teeth in the final position, and then we can do all those other things.
Mm-hmm. Let's talk about the process. First, for someone listening that wants to come in, do you have to have a dentist to be referred to an orthodontist, or can you just come in on your own?
No, you can come in on your own. Of course, we want you to have great dental care, but we can always find a dentist for you if you don't have one. But you don't need a referral to come to an orthodontist.
And what's the process like? A new patient comes to your office, they call up, they have an appointment. I think people wonder, well, what's going to happen at that first visit? How many visits? What's the whole workup process? What
Well,
can a
we
patient
know
expect?
how valuable your time is, so we try to do as much as we can on that first visit. So usually what that includes is photographs of the teeth so we can show you where the problems are, and a panoramic x-ray, which is a picture of all of the teeth in your mouth. And then we have a consultation that same day. So we can sit down with you and review them with you and kind of go over some options. And before you leave that day, you'll know how long it's going to take and how much it's going to cost and what the plan will be.
And can people start that day if they say, let's go, I want straight teeth?
If they're ready, they certainly can, yes.
Really?
Yes.
And then, so let's say it's Invisalign and they want to start. What does the patient have to undergo? You know, I think people are nervous. Is it going to hurt? You know, what do you need to do to my mouth to get that going?
Yes. Well, with Invisalign, we take special molds of the teeth, and those molds are then scanned into the computer, and then we have a virtual image of the teeth on the screen. And then we, as the orthodontist, can go in and come up with a treatment plan and move the teeth where we want virtually. And then we get all of those aligners shipped to us, and we send them out to the patient.
You know, one quick thing to wrap, and then we have to wrap up. Time always flies by. Is you know, I've seen your orthodontic work, and I think it's really amongst the best I've ever seen.
Thank you.
One thing I notice is when you finish a case, it's like that extra 10% of effort. Like that extra little bit, I think, makes a huge difference.
Yes.
And I think the average patient doesn't realize that the teeth can look straight, but the part under the gum and the bone can just be crummy. And
Yes.
maybe just talk for a minute about some of the things that patients don't appreciate that goes into a fine job.
That's called finishing. So we can get the teeth straight relatively quickly, and that's when the kids are saying to us, when can you take the braces off? But there are many things that we have to do behind the scenes to straighten the teeth, like getting the roots in the right position, and we want to get them in a stable position so they stay that way.
And do you think the average sort of, do you get a lot of patients maybe that come in that are sort of like comparison shopping for orthodontics and think it's all the same?
Yes, there are definitely people who are shopping around who just want someone who's on their insurance plan or someone who's going to be the least, less expensive than someone else. But there are many other important things to consider.
You know, one thing I've seen as a periodontist is many times when adults especially sort of go to the cheapest, quickest, whatever, and they think that that's the only criteria, thinking it's all the same. I've seen that initially the teeth look good, but over time they relapse or they develop gum problems or a lot of recession. And I just want to let our listeners know that you really shouldn't underestimate the importance of finding a quality orthodontist, like you or your partner, Dr. Tischler, who really takes the time to finish the case, because it's that extra bit, however many months that takes, that little finesse. It's like the cherry on the sundae. The sundae's okay, but you put some whipped cream, chocolate sauce, and a cherry, and it's really special. And it's not so much more money to do the job really well as opposed to get done, and then have problems later on.
Right, and it's taking that extra time and that extra care and taking an x-ray during treatment and checking on where the roots are positioned. It's all of that.
Yeah, and I think a lot of orthodontists who, for whatever reason, have to rush through the case, sort of get the job done, but can't necessarily take those steps. And I think the average patient doesn't realize really what goes into a fine job, kind of like I see coming out of your office. So I commend you, because every case I've ever seen from yours, an adult or a kid, their teeth are just perfect.
Thank you.
So they look great.
Thank you.
So let's just share with our listeners, if they want to visit you on the web or they want to call your office, how they can get in touch with you.
Our web address is www.wiortho.com, and our phone number is 631-661-6202.
So what would be your final words to a listener who's listening now saying, I've been thinking about this a long time, I don't know, she sounds nice. What should they do?
Just do it.
Just do it. Have you ever had a patient that straightened their teeth that said, man, I regret straightening my teeth and looking better?
Never.
Never. Out of how many thousands?
Never. Everyone is always so happy.
Thousands.
It's worth it to do something for yourself.
Yeah, you never regret it. You never. And you have it forever. So, well, this was great. Thank you for being on the show. It was great to have you. You're listening to Healthy Living Radio. I'm your host, Dr. David Scharf. Thanks for tuning in.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.